Okay, so now we're moving on to my trach suctioning. My patient has a trach that we're going to be suctioning. Her O2 sats are at 89%. Respiratory rate is at 32. She's showing signs of some respiratory distress and a need to be suctioned. So I'm going to go ahead, making sure I have a doctor's order, which I do, trach suction PRN for congestion or respiratory distress. She's showing those signs, so I'm gonna go ahead and perform the trach suctioning per my doctor's orders. I'm gonna go into my patient's room, perform my kiwis. I'm going to identify my patient, matching her name on her identification bracelet, which she has on, Miss Sally Smith, to my doctor's order, stating a 26-year-old female with a date of birth of 2/2/94. I've got the correct patient, I've got my order, so I can proceed to go ahead and begin to suction my patient. Before suctioning, I'm gonna always perform a respiratory assessment, which I've done previously. I'm checking for any chest retractions, nasal flaring. I'm gonna perform lung sounds, in which I've done already, and she's got some bronchi with copious secretions. So I'm gonna be suctioning. And she's also on 30% FiO2, so I know that I'm gonna need to hyperoxygenate my patient prior to starting. So I'm gonna wash my hands. I've let my patient know exactly what it is I'm going to be doing, and we can go ahead and proceed. So I would wash my hands. I've got my suctioning that's connected here. I've got my trach suctioning kit, my some extra gloves, my sterile water, and then obviously my patient with her trach. Okay, so I'm gonna go ahead and wash my hands. Okay, I'm gonna open up my sterile kit here. I can go ahead and open up the box, leaving the paper on the inside. And I'm gonna leave that right here, so that I'm not reaching across over there. Leave that right there. I'm going to check the expiration date of my sterile water. I'm gonna be the first person opening it and using it today, so I don't need to lip it. Expiration date says 2022, so we're good to go ahead and use it. I'm gonna pour some here. Okay, and then I'm gonna put that off to the side. I can also put that off to the side. Okay, so now that I got my kit ready, I can go ahead and remove my patient's trach collar, and then I'm gonna go ahead and get ready to start. So I can open this up. And I stated that prior to me starting, I'm gonna be hyperoxygenating my patient. My catheter is right here. I didn't have the paper for it still, so I'm just gonna go ahead and put on my sterile gloves. Okay. Putting on my sterile gloves. Okay. And then I'm just gonna move this off to the side here a little bit so that we can have space. So now that I'm sterile, I've got my catheter in hand. I've hyperoxygenated my patient. I've removed my trach collar, hyperoxygenated my patient for about a minute, just to allow her to have more oxygen than needed, since she's gonna be off of her oxygen. Okay, so in my right hand is where the catheter is, the catheter, this portion of the catheter is going to be, so I'm gonna whirl that into my hand. And this part is going to be connected to suction. I'm gonna be connecting this to suction, so I know that this will not be, my left hand will not be sterile any longer. So once this is in my hand, I can go ahead and connect this to suction. I'm connected to the suction. I'm going to check my suctioning. And it's working good. Okay, so I've hyperoxygenated my patient. My patient's gonna be on continuous pulse ox throughout this procedure so that we can monitor her O2 sats as we're doing it, so we can know whether or not we need to continue suctioning and whether we need to go ahead and oxygenate her some more. So I'm gonna go ahead and start. As I'm inserting into my patient's trach, my hand is off of the port. I will put my hand on and twist and alternate on my way out once my patient has began coughing. So I'm gonna go ahead and insert. My patient is sitting up in a high semi-Fowler's position as well. So I'm gonna go ahead and insert the catheter. My patients began to cough, so this usually takes about 10 seconds. I'm going to go ahead and pull my catheter out. Okay, I can go ahead and hyperoxygenate her again. Clean this off in there. I'm gonna hyperoxygenate my patient. Okay, and then I can go ahead and insert again. Watching those O2 sats. Her O2 sats are at about 90% right now. She's began coughing, so I'm gonna go ahead and retract. Okay, her O2 sats have increased to about 95%. I'm gonna go ahead and begin another respiratory assessment and assess her lung sounds again to see if they are clear. So I can discard of this in my gloves. This will be done. I'm no longer sterile. I can discard of the catheter in my gloves and take that off. Okay, so I'm gonna go ahead and wash my hands again. I'll put on regular gloves, perform another respiratory assessment. Do some lung sounds again. And she sounds much clearer now. So that would be it for my trach suctioning. I'll go ahead and put my patient's hyperoxygenate her again if need be, and then go ahead and return the trach collar back on her trach and make sure she's comfortable and continue to monitor and assess her. Thank you.